amount of information that people have to sort through now is enormous, and unless you rise to the top of what people are paying attention to, your opportunity for teaching is going to pass you by.
What I have seen in recent years is a real shift towards a much more professionalised use of social media.
It's about improving the evidence base, and it's about improving the way we communicate that evidence base. And I think that's at the heart of improving practice. And we have a really great following on Twitter, and a lot of Twitter users are very involved and engaged in mental health issues.
Researchers being very isolated often and very far apart, and likewise mental health practitioners being very isolated, and it providing this medium whereby we can all come together from very distant places and share in a discussion and share clinical experience as well as research findings.
Our hope is to grab people quickly through Twitter, through Facebook, through our blogs, through our webpage, so that they see something that's important and dig deeper into it to learn more about the question that we're trying to help teach about.
The benefit of the blog is going to be that it will allow us to publish a considered opinion in an informal way. And so it allows writers with really excellent and interesting perspectives to contribute something that might not be appropriate for a formal research article, but that is still interesting and informative and will contribute to evidence-based practice. The Google Hangouts we use more specifically to discuss a particular paper or issue that's going to be of considerable interest to the mental health community and to the research community and to practitioners, and we like to invite experts and people with really interesting perspectives on those issues to talk about it, because that's a really good way of generating interesting and useful debate and discussion.
Is attended by people from all over the world, somebody from the States, someone from the UK, someone in Australia, different time zones. And that's absolutely unique and has never been possible before.
The content that we publish in EBMH is really well edited, and it's really important that people get this kind of information at the top of their list for implementing practices with their patients.
Often studies are conducted in specific contexts that are often highly resourced, whereas in fact the vast majority of the burden of mental illness takes place in countries that have low and middle income levels of resource. So having a journal that tries to condense the research evidence in an accessible way is valuable for practitioners all over the world.